Becoming a dental anesthesiologist can be challenging, especially with the application. But once you get into the program, it's tough. It can be a really challenging residency program. Tell us, Doc, what's been the most challenging part for you these last 2 years about the residency training that you're getting?
Totally forgetting about dentistry, honestly. You go through 4 years of dental school and you learn about the various aspects of dentistry. But once you make it to dental anesthesiology, your primary focus is on medicine and how to take care of the full health of the patient. Most times when we look into a patient's mouth is to determine if they do have teeth and if those teeth would cause a problem with compromising the airway if we decide to, do intubation or support the airway.
Finding dental residency can be a challenge, especially if it's for the first time, and also if this has been your dream, right? But once you get in, it's great until you have to get through and survive on a day-to-day and a year-to-year basis. Stay tuned as we talk to Doc, who's finishing up his dental anesthesia residency, and he's going to share with us how he's been able to survive each day, each week, each month, each year of this training. Stay tuned. Hey, this is Dr. Darwin, a new dentist coach, with another episode of Ask Dr. Darwin on the New Dentist Podcast Show, where we talk about getting into dental school, getting into residency, surviving residency, which we're going to be talking about today, and then life as a new dentist. Guys, continue, please, to share, to comment, and support this channel. This channel is for you, and we spend a lot of time getting episodes together, getting content together so that it can help you in your journey to becoming a dentist. So there's different ways to join. You can check down below. You can become a supporter. You can also join the channel. You can also, we have some merch online as well. Check out those details below. Also, be sure that, again, that you're sharing this content with people, but also this episode is being shared to you by GetIntoDentalResidency.com. GetIntoDentalResidency.com, right here, the ultimate resource to help you get into your desired specialty or residency program this cycle. For more details, go down below. Check out this down below. So today we have a return guest, my fraternity brother, who is, he's persevering. He's persevering. That's probably the low end of the actual day-to-day of him surviving dental anesthesiology. That's what he's partaking in right now as a resident. Join to the show, brother, Dr. Lee. How you doing, man?
I'm great. How about you?
Man, I'm okay. I'm glad that we're able to talk, because it's been a while since you got into residency a couple years ago, and I know you've been busy, so I appreciate you sharing your time today to kind of talk a little bit more about how you've been surviving dental anesthesia these last 2 years. So just in case people haven't checked out the episode from before, and I'm just going to put that up right up here. Check this link here for the episode with Dr. Lee from a couple years ago. But for those people that are meeting you for the first time, please introduce yourself and give a little background on what you're doing and where you're at right now.
Certainly. I started my education at University of Arkansas Pine Bluff, where I completed a bachelor's degree in biology. And from there, I went on to dental hygiene school at University of Tennessee Health Science Center. And that's a bachelor's in dental hygiene. I practiced dental hygiene for several years after I received my degree. And then, the bug bit me to go into dental school. So I figured I could do it. I gave it a try. I was a much older candidate, so I was non-traditional in that regard. But a wise person told me, you're going to be whatever age you are, regardless of what you do. So you might as well do what you want to do, and have a purpose in life. And so I applied to dental school, went to Howard, had a great time, had a great 4 years at Howard, and learned about dental anesthesiology while there, and also while practicing dental hygiene too. But I applied to dental anesthesiology, match got in at St. Barnabas Hospital. And I've been here for about, like you say, 15 months, 16 months or so, loving it every day. Every day is a new challenge.
Well, we're going to talk about those challenges and also the things that you like to balance it off. But I think the first question, especially people who may be now looking at specialties and the different types of specialties, why did you pick dental anesthesia? Why did you pick anesthesia, even though it's not necessarily one of the newer ones, but yeah, it is kind of one of the newer specialties that has been now recognized as a specialty in dentistry. But why anesthesia for you?
For me, it comes from my background of working in dental office and being able to connect with patients, and they can convey to you their fear of dentistry. Like a lot of people hate the dentist. So what my goal was, if I was to get into dental school, was to provide a patient-based experience for those patients that had some fear of dentists or had some roadblocks or obstacles to get to the dentist, and see if I can, kind of alleviate some of those concerns. So what I do as a dental anesthesiologist is I provide anesthesiology to the adult patients. I provide sedation or general anesthesia for those pediatric patients, and also for those individuals that have special needs. I provide sedation, moderate general anesthesia for those patients as well. And so that idea interests me as a hygienist, and also carried over to dental school.
What's a typical week like as a dental anesthesiologist resident? What's your typical week like, if there is such a term called typical week?
The typical day, we typically start at about 6:30 a.m. We are assigned to a room in the OR, so we go and set our room up. If you're familiar with MS MAIDs, you can go on Google and search that term, and it's related to anesthesiology. You can search that term and find out what MS MAID set up. But we use that to set up our room and make sure that we have everything in order before we start. And after our room is set up, then we have a morning huddle or meeting that we use to identify potential problems that can occur throughout the day for the patients that we have already scheduled. After the huddle, we go in and see our patients. They can be either ambulatory surgery, or it can be in the hospital already. We call those inpatients. So we go and see and talk to our patients. We get a brief medical history so we can determine our anesthetic plan prior to the procedure. Okay. So once the surgical procedure is underway, we kind of maintain the patient on anesthetics that we decide to use. It could be totally TIVA, totally intravenous anesthesia, or it could be general anesthesia with gas. Some of you may be familiar with sevoflurane, isoflurane, desflurane. We use those gases to maintain a proper plane of anesthesia for our patients, so they can proceed through the procedure, the medical procedure, without any awareness or without any response to the painful stimuli they may experience. Okay. Throughout the day, though, we're constantly doing different cases, and those cases could be tonsillectomy. Those cases could be a knee replacement, or those cases could be a total mouth rehab for pediatric patients. So we have a wide range of cases that we do, and they're not all just dental cases. These are medical cases. It could be dental cases, but oftentimes in OR, there are cases for a medical procedure, like a lapectomy, laparoscopic removal of a appendix, and things of that nature. And so we have a full scope of anesthesia practice. Now, if we continue on, and as I mentioned, we have what's called um, call. So we take call periodically. So, for instance, if my call was on Monday, my call would be a first call. So it'd be I get there at 6:30 a.m. and I wouldn't leave the hospital until 11 p.m. And through that duration of time, I'm seeing cases, I am evaluating patients, and I'm getting a good idea as to what an anesthesia provider is doing a case in time. We also have what's called second call, and your designated end time for second call is 7 p.m. Sometimes cases kind of run over. The surgical procedure takes a little bit longer, and so you're still there until you finish those cases. And then oftentimes, we try to leave if we're not on call between 3 and 5 o'clock. And sometimes, you may get stuck there a little bit later on because the surgical procedures take a little bit longer, or there's some delay that happens throughout the day. But I mean, that's to be expected with any specialty. So that's no cause for concern there. And then you can just extrapolate that from one day. You can multiply that into 5 days.
So basically, the day is formatted accordingly. Are there any special days where you have special things that you're doing within the curriculum, as in didactics? Is there a special day for like Tuesday, Thursday, where you have certain didactics that are implemented into your typical day or your typical week? How's that set up?
Yeah, good question. So our didactics are typically we have Thursday set aside for didactic lecture, and so within that time frame, we may lecture to the senior residents or the junior residents, or you may have a DA to come in to lecture to us about their processes they use for mobile anesthesia. Also on Fridays, we have what's called M&M, or morbidity and mortality. We have that within the anesthesia department. We talk about cases that went well, cases that didn't go so well, and what can we do to improve the outcomes of the patient experience.
Hey, this is Dr. Darwin, your new dentist coach. Hey, look, it's residency time. It's residency application time. And the biggest question that a lot of people have is, how do I prepare my application? So look, if you're struggling in getting your information together, your CV, your personal statement, or you're ready but not prepared for your interviews, reach out to me ASAP, right? Through my group, Dental Residency Headquarters, we can help you. We can help you get ready for this residency cycle so that you're able to do this. We want you to match into residency cycle this year, all right? But you got some work to do. If you need some help with that application, shoot me an email at newdentistcoach@gmail.com, newdentistcoach@gmail.com. And through our program called Get Into Dental Residency, we can help you. We can help you, but you got to hurry up because residency application is right now. It's right now. So shoot me an email right now. All right, let's get back to this episode.
Gotcha. So reviewing cases, both clinically and also didactically, with your residency program, what research is required of residents as part of the curriculum?
So we have our research component consists of clinical research for the most part. And so the research could be based on a number of factors, what we've done clinically. Say, for instance, one of my co-residents, she's doing research on the NPO guidelines. So what time do you tell a patient to not eat or drink anything? And so the typical NPO guidelines is 2, 4, 6, 8 hours, depends on what the patient consumed, the night before. So what we're doing, or what she's doing with that particular study, is she's using an ultrasound to scan the stomach to see the gastric contents within the stomach to determine if the NPO guidelines are appropriate. And they kind of vary based on the patient presentation also. But we're using this information to have a better understanding of what the NPO guidelines are and what changes need to be made to the NPO guidelines.
So what other research are residents doing or typically will do? I know every year it may be a little bit different based on residents' interest. It could also be influenced by the program's focus, or maybe some of the attendings are currently doing some research and the residents will help out. What are some other topics?
Oh, some other topics would include using ketamine. It's an anesthetic drug, using ketamine for patients that are suffer from depression and anxiety. Will ketamine will ketamine help the patient alleviate their depression and anxiety if they have a ketamine infusion? And next, to what extent, how long would that infusion needs to take place, and what's the doses of that drug? We also have some experience with using a EEG monitor. Some people call it a set line, some people call it a BIS. But the EEG monitor, it monitors the brain waves of the brainwave activity of the patient while they're under anesthesia. And there are some other research topics that my co-residents are engaged in right now. And I do not want to reveal what they're doing, just in case they're trying to present that for a poster presentation. We have the ability to present for a poster presentation or publish papers if we so desire. So I don't want to reveal what they have going on.
Yeah, that's fine. Just so people have an idea, especially those that are thinking about the specialty, and just to get an idea as to what residents do, what their day is like, but also what they do under the area in the domain of research. So kind of like have a good background.
Certainly. And there are some residents that have done some research to determine if propofol, which is a drug we use for sedation or hypnosis, it's a drug that we use. Could you use propofol as your sole agent for a person that's undergoing third molar extraction? Because typically we use it depends on the person's presentation, but we're finding out that if a person use drugs such as marijuana, which has THC, they require a higher dosage of the anesthetic drugs. As to what degree, we're not quite sure about that, but we do know for a fact most patients require a higher dose of drugs. So our typical two drugs that we use for sedation when we're looking at patients in a dental clinic and under the setting to have third molars extracted would be Versed or midazolam. We use propofol, we use fentanyl, we use ketamine. Those are the four typical drugs that we use. And sometimes, there's a drug that some of you may be aware of called Precedex that provides some sedation as well.
Gotcha. I think that helps. That helps. Also, what would be good to learn and to determine as a help mechanism for those that are considering the specialty is the likes, or more importantly for you, what do you like most about the residency so far over these last 16 months?
So far, what I enjoy most is the learning aspect. And so this is what someone called vertical learning. So we went through 4 years of dental school, and we learned about medicine our first 2 years, and we took physiology and that anatomy and those things, but we never did really apply it. And so now we're applying that information to, determine the health and well-being of the patients that we serve. So the most, I guess, fun aspect of the specialty is the learning, because it's a lot of learning.
Yeah, and I think your use of the term "a lot" is probably not a lot. In a sense, it's more than just a lot, at least from what I've heard from others, your colleagues in the specialty as well.
Yeah.
Well,
it's quite a bit of self-directed learning. So, after we finish, if we get off at 5 or so, then we'll come home and read about the procedures in which we undertook for that day. Try to become better at the specialty by, adding just a small tool to our toolbox. And there are some nuances into providing anesthesia that you learn through reading, but you also learn through doing.
Right. Right. And most of that doing is, clinically with patients. And I'm sure there's some simulations that many of you all did probably during that first year to get used to, like you said, applying the anatomical landmarks and things that you've learned, and then being able to simulate that as you transition into the clinic or into the OR as well.
Yes, yes, yes. Our first year as St. Barnabas, we spend the first, let's say, maybe 3 months with a senior resident or an attending to learn about the aspects of anesthesia, to learn about what to do, what not to do, identify when the monitor is presenting information to you, how do you assimilate the information, and when to call for help. Sometimes there can be some issues that you can't troubleshoot on your own. You may need some assistance to troubleshoot those instances. And so you gain that information, you gain that experience by being under the wing of someone else before you in the room by yourself and taking care of a patient. Yeah.
Yeah, very key. So that people realize that part of that learning is being partnered up with current residents and of course the attendings, and you have some simulations so that you don't feel like you're doing all this by yourself.
Right.
That's definitely not the case. Well, when there's things that you like, there's also things that you don't like, whether it's because of you don't know it or you're learning it, you're in the process of learning it, or it's just a challenge. It's something that you maybe have not been confronted with before. Share with us a little bit about what's been some of the most challenging aspects about this residency program for anesthesia.
The most challenging aspect, I would tell you, is the learning, is vertical learning. So you have to be self-motivated in order to take the time to read and to learn about the things that you tried clinically. You got to learn about those things by reading those things in the various texts that we have to read.
So when you say vertical learning, just explain what that is for people who may have not heard that term before.
Sure. So when I use vertical learning is once you finish dental school, you are a doctor. You expect to know what a doctor knows, right? Although you may not have you might have had that didactic lecture, but you still can assimilate this information to understand and make a decision, a diagnosis, right? So vertical learning is you are presented with information that you have to assimilate in order to arrive at a decision.
Gotcha. And that makes sense. Okay. So the vertical learning aspect is a challenge. What else is challenging?
The long hours. You're there all day long.
Yeah.
At St. Barnabas, we don't have what's called overnight call. So we don't have a post calls or we're off the next day, but we're there every single day starting at 6:30 a.m. in the morning.
Saturday and Sunday too?
You have some weekend calls. Typically, your weekend calls are once a month. You may have, additional weekend within a month, so you could be on call twice in a single month. And so it's designed such that your first call on, let's say, Saturday, you're there from 7 a.m. to 7 p.m. Your target time to leave at 7 p.m., by the way. You're not guaranteed to leave at that time. And then let's say Sunday, the next day, you're what's called second call. And so there's another person that's in the hospital there. But if there are some additional cases that arrive, then you may be called in to do those cases. So you need to stay within the city just in case you're called into the hospital.
Gotcha. Okay. One of the parts that people also always want to hear about is advice or tips, especially for two sets of individuals. Number one, those that have been accepted into dental anesthesia and their future incoming residents, and then also those that are applying or want to apply or considering applying to the specialty. What tips, knowing what you know now, what you've experienced and what you're going through these last year and a half, almost 2 years, what tips and advice would you want to share with incoming residents / future residents?
For anyone that's interested in the field, the biggest tip that I can share with you is to really explore the field of anesthesia from a DA's perspective, from an MD perspective, and also from CRNA. Those are your three medical anesthesia providers. So if you can contact them and really have a thorough conversation with them as to their experiences with anesthesia. Also, find information online about patients' experiences with anesthesia. You find out information about how to deliver anesthetic care and what settings you're going to deliver anesthesia to patients in. And all of those factors really can mold your understanding of anesthesia if you look at that. That's for anyone that's interested in anesthesia. Now, if you're considering applying, try to get an externship. There are 9 programs throughout there are 8 in the US and there's 1 in Canada. So there's 9 programs total. And so most, if not all of the programs will offer a externship. It's typically a week. So you get more exposure to anesthesia by externing with these programs. Okay. You can also shadow a dental anesthesiologist. You can contact one and ask, can I come to your office or come to the places where you work and shadow you to get more experience with that. Sometimes the oral surgeons provide their own anesthesia for their patients. So maybe you want to shadow an oral surgeon. So there's different avenues you can take to get a really good understanding as to anesthesia and how to deliver anesthetic care.
Now you mentioned shadowing, which can be done both shadowing an existing DA, and which stands for dental anesthesiologist, and shadowing through your externship pathway that you mentioned. Is there an application process for those externships? And then also, how would people find a dental anesthesiologist? Because it's a little bit different than looking for an orthodontist, right? Dental anesthesiologists, you guys are a very small minority of the dental specialties to begin with, and in such, it can be very challenging to try to find practitioners in the specialty. So what's the best way for people to find out and explore? Like what are some resources people need to go directly to so that they can find individuals for these shadowing and externship?
One direct resource is the American Society of Dentists and Anesthesiologists. From that website, you can identify the residency programs which have DA residents. You can find those programs there. You can also contact the program director to inquire about externing at their particular program. You can also use this website to find practicing DAs. They may have a contact. They may have their contact on the website where you can contact them, and you can introduce yourself and see if they will allow you to shadow them. There's also social media. There are DAs on social media. You can contact them via LinkedIn or Instagram, Facebook, wherever your preference is. They're available. They're out there. You can find them. You just got to know the channels to go to find them.
And that's a great point, because we're talking to one right now. What's the best way for people to contact you if they have questions about the specialty and what you're doing as well?
I will say that it's a grueling undertaking that I'm going on, and my hours are very limited, so it may take a delay to contact you back, but I will try to contact you back. My Instagram handle is Doglips. I also have another page called L7 Dental Concepts, which I don't spend much time on. I thought that I was going to kind of expand my content there. I haven't had time to do it. You can also contact me via email at contact@l7dentalconcepts.com. So those are the 2 ways that you can contact me.
So check those out right there. There's the email. And also, if you give me the Instagram, can you spell that out again?
Sure. Instagram handle is Dawglips, DAWGLIPS.
Gotcha. Before we wrap up, we want to learn a little bit more about what your future plans are, because even though it doesn't seem like it's close, but you're going to be wrapping up this residency pretty soon, man. And you mentioned the different modalities or different ways that the field and the specialty where people practice within the specialty. What are some of your plans after residency?
That's actually a very good question. I alluded to earlier that I wanted to provide content on my social media page that will, kind of give some guidance to patients as to what to expect as far as dental anesthesia is concerned. I wanted to do that, and that would be a free resource for patients to use. As far as my career goals are, and most of the dental anesthesiologists are doing mobile anesthesia. They're going to different dental offices. They're bringing in their equipment, whether it be general anesthesia, you have anesthesia machine to deliver the gases for that, or it can be TIVA, totally intravenous anesthesia, where you using medications, as I mentioned before, propofol, fentanyl, you're using midazolam. You can using those drugs to deliver the anesthesia. So my ideal career path would be mobile anesthesia. We're providing mobile anesthesia to dental patients in dental offices, but also have a desire to be in academia as well. So maybe to teach anesthesia at a university.
That will be well welcome, because it would be great to have you on the academic platform, especially so that dentists, students, aspiring dentists, pre-dental students can see more faces that look like them related to a specialty that they're interested in as well. Well, I will tell you, man, this episode has been very helpful. It's been very interesting. They kind of give us a little better insight as to a typical day of a dental anesthesiologist resident, and what your day is like, what your week is like, and some of the challenges, some of the things that you like the most about the program, and then also those tips. So hopefully, guys, you have gotten some value. Put a comment down below and let us know, what did you like most about this episode? What did you like most about this episode? Also, check out these episodes right here. Let's see where they at. Right here. There you go. Check out these episodes right here. Hopefully they will help you as well. And that's our time. Love, peace, and smiles. Go to the next video. Go to the next video right now. Just go.